Nurses are joining the chorus of workers who are experiencing the city's increase in violence. Nationwide, cities like Chicago report higher crime on the ground, while even flight attendants say they're noticing it in the sky as well. Amanda Vinicky joins us now with more. Amanda, what are the nurses saying?
Well, Brandis, it wasn't all that long ago that nurses were among those being celebrated as healthcare heroes, hailed with free meals, applause, signs thanking them for their service. ER nurse Paul Patter says that now it all feels like a PR stunt.
We've gone from the heroes of the COVID pandemic to who cares? Get back to work, shut up. We're moving on. This pandemic's not over and people are still getting sick. Nurses are still getting sick, even with the vaccine.
He also says nurses are literally coming under attack. Debrisha Flowers Anderson is also a nurse at UI Health's emergency department and says she understands that patients come to the hospital with anger and anxiety.
They're in pain. They may have lost a loved one. But what I can't understand is the physical abuse that is placed upon us to take care of them because they're scared. I have been followed and chased. I have been threatened with battery. I have been threatened with rape. I have been hit in the face. I have been spat on, and I have been spat at. All of these things have left me emotionally and physically scarred.
Both nurses took part in a picket organized by their union as well as SEIU earlier this week, protesting what they say are unsafe conditions. They say 18 nurses have left UI Health in the past year due to what they call unsustainable and dangerous situation. Patter's been unable to work since late August when he says he was attacked by a drunk patient who'd agreed to take a COVID test.
They were allowing me to perform the test until the swab went in the patient's nose, and then they just kind of flipped out. That patient had kicked me in the stomach, the chest, the shoulder, and these didn't really connect, but the shoulder did. It spun me around. And then the patient kicked me in the lower back, upper gluteal area.
He's recovering from surgery and he may require another. In a separate incident, a patient brought a gun to the ER and then another time cut through metal detectors with knives.
Incidents keep occurring, and it's just a matter of time before someone gets seriously hurt. Now, not to say that I wasn't seriously hurt, because I have to have 2 surgeries to get me back to where I was prior to this. But I don't want to see one of my staff members die. I don't want to see another patient die because, we were lax in because the hospital didn't want to spend the money or put in the effort to make sure that people are safe.
Now, among the issues, he says boarding, really meaning that the hospital, he says, can't handle the volume of patients coming into the ER. A Tribune investigation did find that U of I's hospital saw ambulance volume double since Mercy Hospital stopped receiving fire department drop-offs earlier this year. Now, a spike broadly referenced in a statement from University of Illinois Hospital CEO Michael Zen, who says that the health needs of patients, including those who previously sought care at Mercy, are significant. Then in a statement going on to thank UI Health nurses for their dedication, noting that patients are increasingly seeking care for conditions that had to go or did go unaddressed during COVID clampdowns. These events continue to challenge our capacity and staffing, particularly in the emergency department, Zen says, but these challenges have not resulted in patient harm. And we have seen new action on several fronts to support our ED staff in delivering high quality care to our community. And those actions, UI Health says, include hiring 29 emergency department nurses this year, the majority of whom are under an arrangement that provides for more flexibility in shift staffing, creating a step-down unit so that patients ready to be discharged from the hospital can free up space so that then ER patients don't have to wait for a hospital bed. And then when ER patients do have to wait to be admitted to the hospital fully, staff from inpatient unions instead of ER nurses can help to provide care. Then when it comes to security, UI Health has hired on-site police officers. Also, unlike many hospitals, has metal detectors at emergency department entrances, and ER nurses receive extra pay when there is overcrowding. While we have a responsibility to our nurses, who are among the highest paid nurses in Illinois, we also have a responsibility to our entire staff, to our patients, and to the state of Illinois that requires we manage our budget responsibly, Zen said in a statement. He says that he invites the hospital's nursing colleagues to join with him in finding solutions. Now, the nursing union leaders, they have some ideas. Patter says that in the interim, at least, nurses from other departments should be incentivized to help and to take on extra hours in the emergency room. Also, he wants 7 more ER nurses hired.
Right now, nurses are working so hard, they don't get lunch breaks. They can barely go to the bathroom. It's not a nice place to work right now. And I think the other thing they need to do is hire more security staff.
They want security in the waiting room 24/7, and for that security to be required to intervene when a situation erupts.
We also would like them to provide staffing for security or police to sit with these violent patients. I am not trained to de-escalate. I am not trained to take down a violent patient. They are. So we need the people who can do the best job in that position. That's not a nurse.
Patter is unsure when he will be able to return to working in the ER. He says he doesn't want to be a healthcare hero.
I don't want to be a hero because the hero dies at the end. Like I want to live, and I want to live my life, and I don't want to sacrifice myself or my family for someone else's profit, someone else's motivation, someone else's victory.
The hospital, meanwhile, says that it continuously evaluates patient care as well as staffing needs and pay. Now, reminder, as CPS parents well know, no school tomorrow for Vaccine Awareness Day, and U of I Hospital is one of those that set up and expanded their vaccine clinics so that those newly eligible 5 to 11-year-olds would be able to get an appointment booked there. And with that, Brandis, back to you.